Section 4, Types of Imaging Techniques. In radiology, the word modality refers to the type of imaging technique used. Each one offers different advantages depending on what the doctor needs to see. Here are the main ones. General radiography, also called plain film or X-ray, it captures still images of bones and internal organs. Computed radiography. This uses a special image plate that must be processed digitally. It was the first step in moving away from film. Digital radiography, a more advanced system where images appear almost instantly on a screen, no need for processing or film. Fluoroscopy, a real-time imaging method often used during surgeries or procedures. A portable version called a C-arm is used in operating rooms. Mammography, this is a specialized X-ray used for breast exams. There are two types, one for screening and one for diagnosing problems. Bone density scans. These are used to check for conditions like osteoporosis. The scan measures bone mineral content. Computed tomography. This method takes detailed images or slices of the body. It's great for viewing internal organs. Magnetic resonance imaging. This uses magnets and radio waves to create images of the body's soft tissues. Some machines can even capture brain activity. Ultrasound. This uses sound waves to create images. It's often used to check on pregnancies, blood flow, or organs. Some types of ultrasound include 3D imaging and heart scans. Nuclear medicine. This involves using small amounts of radioactive material to detect disease. Special cameras pick up the material to create images. Radiation therapy. This is a treatment for cancer using high doses of radiation to shrink tumors. The radiation can be delivered from a machine outside the body or from a device placed inside the body.